All right. Good afternoon, everyone. Thank you for joining us again with Clark County Cares. This is day 6 of Drug Facts Week, and I'm happy to have everyone here with us and our legislators. I would say local legislators, but you're local to me, but you're our state legislators here and policymakers. So I'm going to give a brief introduction, and then we will just turn it over to the panel. To my immediate right is Representative Ed Clere from District 72. And I'll be honest with you, until recently, I had no idea what districts were, where they went, or anything like that. But Ed, Representative Clere, Ed, we've been friends for a while. Grew up in Southern Indiana. He's been a resident of Clark or Floyd County for most of his adult life, and has served on multiple boards in the area, education, the YMCA. You're part of the youth, was it soccer, something you were on? So he served his community and served it well for most of his adult life. Dr. Eric Yazel, next to Representative Clere. If you've been following Clark County Cares or Drug Facts Week or any of the local news in the last couple of years, you've seen Dr. Yazel on pretty much everything. He's the Clark County Health Officer. And Dr. Yazel, I'm not sure what his topic is going to be today, because we go to him anytime we have any kind of questions or any panels, because he knows a little bit about everything. But he's going to talk about the syringe exchange and how he's been active in that program. He was instrumental in keeping that alive after Dr. Burke left the Clark County Health Department. I'm going to move on because I could talk about you for hours. So next to Dr. Dazzle is Representative Rita Fleming. Okay, Chris was the other senator. I was like, no, we had a senator here. Right, Rita Fleming, District 71. Again, I never knew what that was until very recently. But Dr. Fleming came up in the area and was practicing. Actually, you still practice?
Retired a year ago.
Good for you. Congratulations on that. Several boards in Jeffersonville government. There was a planning and zoning. When she wasn't delivering babies, she was helping make the community a better place to be. So we're happy to have Dr. Fleming on the panel as well. And then Senator Ron Grooms, familiar face. Ron's been in the area forever as well. I've known Ron since I was about 14, I think. And Senator Grooms has been, was a pharmacist, owned Hangers Pharmacy, and was on was a Jeffersonville City Council for 80s, 90s, and 2000s until he went to Indianapolis. So we're happy to have Senator Grooms here as well. Senator Chris Garton had to cancel it wasn't last minute, it was last night. He gave us plenty of notice to work with him. Luckily, his family member got to play, was it basketball, Barbara? I'm not sure what ball. There's a sport that he hasn't gotten to play in forever, and they opened it up today, and Chris got an opportunity to take his child to Bloomington for that sport. And during the pandemic, we've all missed out on so much. We had to back him in that. Plus, family is so important in recovery and everything else that we're talking about this week, that Chris setting the example as a family man, we had to endorse that wholeheartedly. So I'm going to turn the microphone over. The Representative Clere is going to tell us whatever he wants for now. We'll have some questions at the end. But Representative Clere, tell us what interest you have in Drug Facts Week, maybe some of the legislation you're a part of, or whatever you want to talk about. So, thank you very much, sir.
Okay, thank you. It's good to be with everyone virtually today, and it's good to be on a panel with my colleagues here and Dr. Yazel, who is, of course, the Clark County Health Officer, but a champion for public health throughout Southern Indiana and the entire state of Indiana. He has graciously come up and testified on several occasions on legislation with which I've been involved. Including, we were just chatting right before we went live about syringe exchange, and I know that's a topic of interest to everyone who is joining us on Facebook Live, and certainly has been a topic that all of us on this panel have worked on. So last year we had a provision that extended the authorization in state statute for syringe service programs for 1 year. And I'm pleased to report that in House Bill 1203, which I'm co-authoring, we have an extension to 2030. So Maybe Senator Grooms will be able to give us a preview of how that is likely to fare in the Senate. But at this point, that made it out of House Committee. The House Committee on Public Health, right, Representative Fleming, you're on that committee. That was just a couple days ago. So she may have some more comment on that. But that provision is the provision in state statute that allows counties to establish a program. And as Judge Jacobs mentioned, Dr. Yazel continued the wonderful work started by his predecessor, Dr. Kevin Burke, and has taken that program and expanded it and done exciting new things with it. And we're seeing not only the impact that it has in terms of harm reduction, but we're seeing the connections that you guys are making to treatment and recovery, and also to a host of other resources. So I won't steal your thunder. I'll let you talk about that. But I guess beyond syringe service programs, just talking generally, I think one of the things we have to be very mindful of right now is that even though substance use continues to be part of the daily reality for far too many Hoosiers, it seems to have receded somewhat as a top legislative priority. That's not to say that it's not still a legislative priority, but I don't see it at the top of the list anymore like it was a few years ago. And I think one of the greatest challenges going forward is to remember, again, that it is a daily reality for Hoosiers and Hoosier families and communities throughout the state. And we need to keep it at the top of the list because our work is far from finished. And I know my colleagues will agree with that. And they're both very involved, along with Dr. Yazel and Judge Jacobs. And, I look forward to continuing to work with all of you on this issue and continue to look for ways to support things that are already working. Certainly syringe exchange, but lots of other things as well. And to find the funding that is necessary, because that continues to be, I think, one of the biggest obstacles. So I'll leave it there and hand the microphone over to Dr. Yazel and look forward maybe to some questions and discussion.
Yeah, thank you so much, and hello to everybody out there, and thank you for having me as well. Couldn't have a better group to be up here with. We're really blessed here in Southern Indiana to have the leadership we do, especially in the area of public health. I am in regular contact with everybody up here and Senator Garton as well about various issues, and it's just awesome to have that leadership. And they've been instrumental in a lot of things that we do down here as far as, grant support and different programs and initiatives and things. And, we're just really blessed to have that level of support and leadership. And, one of the things that obviously we're here today about is substance use disorder. And, as Ed said, it's, sometimes, for the last few years, our numbers are improving so rapidly, which is wonderful, but I think it does lead to some complacency sometimes, and people saying, hey, maybe it's not as much of a problem anymore. And COVID-19 showed that just how fragile that balance is, that any kind of interruption in, the daily support systems and, daily routines and programs that are out there and things can lead to devastating results. And we've seen a resurgence of substance use disorder and overdoses and things like that. So just kind of underscores that we've got a lot of work to do. And, one of the things I do advocate for is our syringe service program. And, that's the thing for someone who, this may be the first time you're really hearing about that. It's more than just syringes. What it is it's a relationship building, it's advocacy, it's access to the healthcare system where someone might not normally have access to. A lot of people who use IV drugs have had adverse healthcare experiences. So this is where they build trust. From a humanities standpoint, it's the right thing to do. From a medical standpoint, it's the right thing to do. From the teachings at the syringe service program, our skin and soft tissue infections, endocarditis, other medical problems, our HIV and hepatitis testing, all those services are for absolute huge medical benefit. And even from a financial thing, we've estimated that somewhere between $2 and $5 million a year of medical expenses are saved through the education and testing that goes on our syringe service program. So, and we're really proud that despite all the interruptions during COVID-19, we've been able to keep our program up and running without interruption. And I think that's a testament to all the healthcare workers out there who, especially early in the game when there are a lot of unknowns, that shows a lot of bravery and dedication. So, and it's just one of many programs that we have, available in the community. And again, that are as a direct result of some of the support from our local legislators. So. And I'll turn it over to Rita.
Thank you very much. We cannot become complacent. I think that we found out that things work or are at least making a big dent in the problem and took them perhaps for granted. And then, like Dr. Yazel said, COVID raised its ugly head, and we realized that the support services, the availability of healthcare providers, the wrapping your arms around people and letting them know that they are cared about went away for a while. And those are very important components of dealing with the substance abuse problem. I am here because the problem exists. We have made inroads, but there's ups and downs, but also because of my experience as a women's health care provider. Substance abuse disorder hits families hard. Women and children are particularly affected. And I think that we cannot ignore their needs that arise from substance abuse or may be related to substance abuse. This coming week, I have a meeting with Doug Hunsinger. He is making remarkable progress as the drug czar. We're going to talk about two things. One is we've identified substance use disorder as the most common factor in pregnancy deaths, pregnancy-related deaths. And we have to do something about that. And before the problem occurs, if we could get access to birth control for women at places like syringe exchange programs, treatment centers, emergency rooms, we know that we can make an inroads, save lives, and save money. We have to be innovative, though, because I explained in the newspaper article today, you cannot expect people in the grip of a substance abuse disorder to follow the traditional, somewhat burdensome route of making an appointment, sitting in a doctor's office, and then hoping to get their birth control. The other thing is I want to track how are we doing with looking at our providers. One of the tasks of the drug committee was to look for outliers. Most healthcare providers, doctors, dentists, advanced nurse practitioners, PAs, are careful in their prescribing of opioids and other drugs that are addicting. But we want to identify the outliers. And then we also want to establish best practices because we know that oftentimes sending a patient home with a 30 Percocet or whatever after surgery is far too many for most procedures. And that's where addiction starts so often. People don't start out intending to be drug users, but they may have some factors that make them more susceptible. And then we're not helping by not being innovative in helping manage their problems. So we'll see how that meeting goes. I look forward to it.
Thank you, Dr. Fleming. Thank you, Judge Jacobs, Barbara Anderson. Thank you for hosting this and being part of it. It's always good to be back in your home district to talk about events going on. And this event is not recent, of course. I'm Ron Grooms. I serve in the Senate on the Health and Provider Services Committee. I also serve and chair a committee named Family and Children Services. And I'm also on Senate Policy Committee. And I don't know how to use this. Closer to my. Is that better? So the committees I serve on are Family and Children Services, Health and Provider Services, and Public Policy. And this issue touches almost all of those. In 2014, I authored a bill called the so-called Pill Mill Bill, which impacted dramatically downtown Jeffersonville and southern Clark County in particular, but it was wider than that, as we all know. That Pill Mill Bill initiated limitations on prescribing of physicians, limitations on dispensing by pharmacies and healthcare professionals. And it was the beginning, I think, of what was so critical to gather the intention of the legislature, plus the medical community, plus the provider arena. So I always like to think of that as being the start of the awareness, treatment, and making other legislators understand what the issues were. And of course, you know, that became and is still a big problem in southern Indiana as well as elsewhere. In my pharmacy, I remember very clearly in 2014-15, hydrocodone dispensing, which is an opioid narcotic, very popular, and then OxyContin or oxycodone. Hydrocodone dispensing by the pharmacy that I owned went tenfold in 4 years. Unbelievable growth. And then oxycodone became popular and very popular. And I remember medical service representatives promoting the use of oxycodone as being very safe and effective and not habit forming. And I kept looking at those medical service representatives thinking, how can you make that claim not habit forming? Do you think I'm, you know, I'm a trained person, professional pharmacist? You know, how can you make that statement? But anyway, we have a tremendous challenge in Indiana to develop treatment centers and methods of treatment of those addicted to the opioid narcotics and other substances of abuse. We also need more education. We need to find a way to get into the schools early and make the children in the middle schools and the grade schools understand what this does to our society and how much it costs society to treat and maintain people that just simply have an issue with overdosing and addiction. And so those are some of the things that I think we need to continue to address. FSSA does a great job in Indiana. That's the Family and Social Services Administration of addressing this issue. And if you want more information, go to their website under in.gov and click on FSSA. It's a great source of information. Representative Clere mentioned the syringe exchange program. I don't know. I can't comment on that. I've not seen the bill, and I haven't talked to any of my colleagues about that in the Senate. That pretty much covers what I think where we've been, where we need to go. We made some great progress through 2017, but it certainly is going the other way recently. And part of that, of course, is because of the COVID virus and the other issues that go with the stress and strain of raising a family and maintaining just your sanity right now in some of these situations and home situations. So thank you for the opportunity to be here today. We have a major challenge, but we've faced those before, and we'll continue to make progress, and we'll continue to improve. It just takes time, and no one likes to hear that word, takes time. But thank you to my colleagues for being here today. Dr. Yazel does an awesome, tremendous job. I'm not just trying to impress him with my comments, but you ought to hear some of the comments from other health directors in other counties in Indiana, and you would certainly be proud of Clark and Floyd counties and the work that they do in southern Indiana. Thank you, Doctor.
Thank you, Senator Grooms. I don't know that we have any questions from Facebook yet. Do we have anything yet?
We've got 2 or 3 questions,
While we're looking at that, Representative Clere, how comfortable would you be talking about the bill you had mentioned? I don't know what stages we are, if you want to, how much you can divulge what's supposed to be private at this stage.
The syringe exchange?
Yes, sir. Thank you. I want to hear more about that.
Yeah. Well, we do have some questions. Okay. Oh, okay. Yeah. There's really not too much to talk about. The authorization for syringe service programs, would have expired had we not extended it in last year's legislative session. And I can't remember what last year's bill would have provided for originally. It would have been a multi-year extension. I can't remember how many years it was. But that bill actually died on the Senate floor, which was why I was asking Senator Grooms if he had a prediction or any sense of how this year's legislation may fare. But House Bill 1203, which is the State Department of Health's so-called agency bill, contains language to extend that authorization for syringe programs through until 2030. So through the end of the decade. And it passed out of the Health Committee, right, Rita? Yeah, on when was it Tuesday or Wednesday? Wednesday, yeah. So it passed out of the House Public Health Committee, which Representative Fleming is on Wednesday. I think it was unanimous. The bill was unanimous, including that provision. But that's all it does is extend the date. And one of the compromises we made when we worked on the original legislation, which I authored in 2015, was to require local approval for syringe service programs. So extending the date merely says that counties or municipalities can continue to operate a program or can start a program until that date. So it doesn't do anything to establish additional programs. One comment I would make, I've lost track of, I want to say we have 9 counties now. Does that sound right, Dr. Yazel? I think we're at 9. We've been as high as 11, I believe, and we've had a couple that have dropped out, unfortunately. But the last time I looked, I look at the population that's covered by the counties that have programs. They skew, even though we have several smaller counties in terms of population, the counties that have programs, including Clark County, skew toward the more populous end. So even though we only have about 10% of Indiana's 92 counties operating a program, those programs cover almost a third of the state's population. Now, in my opinion, we need to get programs started in other counties. I wish we could do it statewide. That just wasn't where we were politically in 2015, and I know it's not where we are politically today. So I applaud champions like Dr. Yazel, who are making those programs so successful and doing so much with them. I'm glad he touched on the other things that the program is doing and the money it's saving, which I think is sometimes something that is often lost. But all the legislation does is simply extend that date. It doesn't change the authorization process or any of the other requirements around syringe service programs, even though they require local approval, which has proven very difficult in many counties. Once a program is approved, I think Dr. Yazel would agree that our statute allows for evidence-based practices. So I don't know if you have anything more to say about that, or if Dr. Fleming might like to comment on the committee process the other day.
Yeah, just one thing I'd like to mention really quick is when we talk about the endpoints of a syringe service program, if I have a program, without a date that's extended more than a year or so, basically what I have to do is plan for the end of that. So, because you can't just all of a sudden one day say, hey, we're closed now. The public health ramifications of that would be disastrous. And so by extending that window, that actually allows us to plan and run a much more effective program and just more broad-based interventions and things like that. So extending that window for those programs is huge for us, locally and statewide. So.
It was very nice to see that members of the Public Health Committee were aware of the situation. There was no opposition in committee at all, and I hope that this continues throughout the House and ultimately into the Senate. I think people are beginning to realize that it does not increase drug use. It helps keep people safer. It helps save money for the state. If we can prevent HIV and hepatitis, treatment, $70,000 a year for hepatitis B, closer to 100,000 for an HIV treatment. That's a lot of money. And then people feel better. They're not transmitting diseases to others. And then they are given the opportunity to seek help beyond what is given at the syringe exchange program. And there may be no other way to reach these individuals and give them the option of going into a treatment program, or at least talking to someone about how that might work for them. So it's necessary and it's life-saving.
And I agree with that 100%. And what I've been happy to see locally, at least, is we haven't gotten the same amounts of pushback that we used to get. When the syringe exchange was first proposed, I mean, everybody was up in arms. And I always talk about my mother, God rest her soul. My mom would have been totally against that, because you're just asking them to go out and get high, which I think things like this, again, thank you guys, community outreach and education has helped reduce some of that pushback. Have you guys seen that in Indianapolis as well, that where you may have not wanted to stick your neck out 10 years ago, now it seems like it's more commonplace? You may want to.
Thank you. I think part of the reason it's more accepted is we know people, their family members, their neighbors. It doesn't matter what area of town you live in or what your income is. Substance abuse affects everyone. And I think that knowing that it is our friends, neighbors, and relatives who are affected by this disease makes us much more aware of the need to continue things like syringe exchange programs and treatment opportunities.
I'm going to read directly from some Facebook questions, and these are not my words, so I don't understand them. But for Dr. Yazel, can you speak to how SSPs currently interact with other health systems, and do they address contraceptive care?
That's right after your own heart there. I was going to say. So we do, because basically we call it the syringe service program, and we do education, we do referrals for treatment, and also referrals for medical care and things like that. So we are a community partner and all that. And so we work with all the health organizations in the community, as far as, helping people access recovery, help people get medical care that they wouldn't normally get if they were not accessing the program. So yes, we are a definite partner there. I do think one thing we could do a lot better, and a hole in our services, is we aren't overly active in the contraception part of things, and I think that's a real area of improvement and helping with access there. So I'm sure you probably have some words there.
Thank you. The last week I've spent with meeting after meeting with other healthcare providers, including people on the Maternal Mortality Review Committee, and all agree that we need to take these services to where people are. And one innovative idea, and I think we're going to really investigate this, is a traveling van, a healthcare van specifically designed for contraceptive services. And I think we're looking more at the implant in the upper arm as a very reasonable, long-lasting type of contraception that we could safely offer women. I think the uptake would be tremendous because just like Amanda, the nurse practitioner quoted in the evening news today, said almost 100% of her clients who are women say they want birth control. So I think there's a lot of promise here, but we're going to need a lot of partners to do this.
And Dr. Fleming is skipping over something out of modesty, I'm sure. She has a bill right now that she's working on with another representative, actually several other representatives, but this is Dr. Fleming's idea, and that is to allow pharmacists to prescribe contraceptives, oral contraceptives. And I think that could be a game changer as well. So would you like to say a word about that?
Thank you. This bill would allow a woman 2 a.m. on a Sunday at nights when perhaps her husband is home, and when she works during the day, she can't go to a doctor's office. This would allow her to go to a pharmacist, complete a health survey, get her blood pressure taken, and get birth control pills or patches on the spot. This can be done safely, and it's been done successfully in several states. It has shown to decrease unintended pregnancies and abortions. So I think that could appeal to a lot of people. Again, it takes the motivation to go to the pharmacist, so that may be lacking in some women with substance abuse, but it could be a step in the right direction for many women, especially those for whose access during regular office hours or due to geographic locations that make it difficult, form a formidable barrier for them.
I think a lot of you out there who haven't either suffered from substance use disorder or worked with people with substance use disorder, this may be a difficult kind of concept to wrap your head around. I think a lot of us think about, we just put that little appointment card on our refrigerator and we go see somebody on this day, and all those things happen. Well, in working with people with substance use disorder, it's all about meeting people where they're at and helping them access the system. And sometimes you have to kind of think outside the box, and whether that be from the emergency department, the syringe service program, our ER follow-up clinic, you've got to really increase those access points. And I always say we have to set up the system so that some people are going to fail the system, but we have to set it up so the system doesn't fail them. And we still got a long way to go in that scenario. So.
Thank you. Directly from Facebook, Representative Clere, is there any mechanism or discussion for a county that needs a syringe services program that doesn't have elected official support? So is there any discussions about taking that out of local elected officials' hands and putting somewhere else?
Well, thanks for the question. Again, when we worked on the original legislation in 2015, it was obviously a response to the crisis in Scott County, but it was also an opportunity to do something that, frankly, would not have been politically possible had it not been for the crisis in Scott County. And as we worked through the legislation, we encountered a number of hurdles. But as I said earlier, I'm proud of the fact that our legislation, our statute, allows for evidence-based practices. The challenge, of course, as the person who asked the question has identified, is local authorization. And I guess I wish where I'd like to see us go is to allow syringe exchange or syringe service programs statewide with requirements for local design and implementation, because I think there is tremendous value in community engagement and buy-in. And Dr. Yazel may be able to speak more to that, but I think Clark County is really a model of that, because this his program, Clark County's program, does not exist in a vacuum. I think it is Dr. Burke's original work on this was responsive to the unique needs of the community, and Dr. Burke engaged the community, and Dr. Yazel has continued that and has established links to all kinds of community resources and providers and just all the assets and resources that the program now delivers. So there is no mechanism right now to establish a program without authorization, without commissioners, or it can be done by a municipality. I don't know, we haven't had a municipality do it yet. We have Marion County, which of course has unified city county government and is the most populous county. But I don't think we've had any municipality try to do it on its own. I guess my advice would be, I don't know where the questioner lives, but I would love to see a program in Floyd County. I've had those conversations over the years, and it's been hard to see such a successful program next door in Clark County and no program in Floyd County. So I'd love to help in any way that I can. If the person asking the question is from Floyd County, please reach out to me, and I'd love to sit down and have a conversation. But wherever you're from, if you don't have a program, bring people together to start those conversations. Get your health officer involved, talk with your commissioners, get physicians and other folks in healthcare to come to the table and talk about what might be necessary to do the education and advocacy to make it constructive and make it something that the community can rally around and take ownership of. I think people have warmed up to this. I know that syringe programs are still controversial in many circles, but I've also seen a lot of people locally and at the state level, including in the legislature, who are much more open to these programs today than they were 6 years ago in 2015 when we started talking about it. So the other thing I would say real quick is, when we were working on the problem in 2015, I worked with IU, and we came up with a model looking at at-risk counties. And the primary factor we looked at in terms of risk for an HIV outbreak was the prevalence of hepatitis C. And although Scott County was certainly at the top of that list, there were and there remain, a dozen or more Indiana counties that do not have a syringe program today, but still have those same risk factors that Scott County had when the outbreak occurred in late 2014 and early 2015. So, Dr. Yazel or any of the others have any further comments on that in terms of community design? You might want to talk about, Dr. Yazel, the community buy-in to the program and how important that is.
Yeah, I think it's huge. I think, a lot of people who haven't had familiarity with this, it elicits a very visceral reaction. I mean, it kind of goes against everything you were brought up to, to hear about. And, especially I say, be patient with your law enforcement guys. I mean, that's different than anything they've heard their entire career. And, I think it's, but just encourage people to take some time and sit down and have a frank discussion about things and say, here's what actually goes on there. And I think, the first and foremost, you have to realize that, people who are using IV drugs are going to do that, whether that syringe service program is there or not. I mean, that's been shown time and time again on various studies. So once you come to that realization, some of the other services there start to make a lot more sense. And, but I think it's all about meeting people where they're at. And if you're trying to start a program in your county and you're getting a lot of resistance, there's other things you can do first. Start a Narcan training program. Do some enhance your recovery services. Do things like that show that you can run programs in a quality, responsible way, and then continue to engage along the way. And I think as you have successes, you'll get a lot more buy-in from some of your people that may be hesitant to support and things. So, a lot of times if your first interaction is to, barge in the door of a, police chief or commissioner's office and say, I want to start a syringe service program, you're probably not going to have a great interaction. But if you've had that dialogue, you've done other programs, you've sat down and had some frank discussions, you're going to get a lot more buy-in. And then, the second part of that is, that's a two-way street. You've got to run a good quality program. You've got to do it the right way. You've got to have a great return rate. You've got to get people into recovery. You've got to do all the things that you laid out there as justification for your program. And we're really proud of what we do here in those areas. So.
Any other questions?
We need to take a quick break. We've got change out a battery in the camera. So give us just a minute or so. We'll be right back on. Just that's fine. They're saying 30 seconds. All right. I think we're back to good. Senator Grooms, did you want to weigh in on something? I thought you had your hand out.
Which side is it? This. Representative Clere mentioned the Senate in his discussion about the syringe exchange. I believe, if I'm not mistaken, the bill passed in 2015 and had a 5-year limitation on how the effective date ending 5 years from when it was passed. 2 years ago, I remember a meeting in Albany discussing this issue, and the result was a bill that extended the program for 2 years, such that it would expire in 2022. I believe I'm correct. And the opposition in the Senate, I don't know what that mood is right now. You have to remember, we're in the first half of the session, and none of the bills from the House have come to the Senate, and none of the Senate bills have gone to the House. So we have a couple of weeks or so, actually, I believe 3, to move those bills to what we call the flip date, where they flip houses, so to speak. So I don't know. I know that in the Senate, the Health and Provider Services Committee, which I sit on, that committee has 36 bills to hear. So the discussion about this issue hasn't even started in the Senate, not so much because of any preference for or against, simply because of the backlog of bills and the mechanics and the logistics of which we have to work under right now, which is totally different from what most of us are used to. So right now it's a big unknown. I can't comment any further on that other than to lay out how it may progress. It'll come from the House, then it'll go to the Health and Provider Service Committee, then probably a conference committee, and then have a result after that. Thank you.
And thank you for clarifying that, because I think most of us, you guys know, most of the rest of us don't really entirely get how that works, that it goes from the House to the Senate or vice versa. So thank you. One of the questions we had, I'm addressed to you, Senator Grooms, because it was about, is there legislation pending or been proposed to either criminally charge providers who overprescribe addictive medications, or to put some heavier regulations in place? And if you know.
Thank you, Judge Jacobs. Yes, there are penalties for those who overprescribe. There's very clear standards on day supply and quantity limitations on what can be prescribed. As you know, you have to have a license to prescribe certain treatments programs for addicts, such as methadone, et cetera. So that's another category of limitation. The prescribing has to be by a licensed professional who is trained in prescribing. There's also a tremendous penalty to pharmacists for dispensing more than is allowed by a patient in a 30-day period or an initial prescription that's written. There is legislation, I believe I've seen as an amendment that may be coming. The first prescription for an opioid prescription by a prescriber to a patient, the first time that's prescribed is limited to 7 days, 7 days supply. There's a heavy penalty for that. And so by limiting the number of days supply, by limiting, they're not refillable, by the way. Schedule II narcotics, opioid prescriptions are not refillable. Prescription has to be rewritten. On the second prescription, after the first 7 days, it can be written for up to a 30-day supply. In some states, it's 21 days supply. And of course, insurance companies and pharmacy benefit managers are putting controls on opioid narcotics and other substances of abuse, limiting the drug, limiting the supply, and limiting the prescribers who can prescribe opioids. Very seldom would you see a podiatrist need an opioid narcotic, but right now they can prescribe if they have a DEA license.
Thank you. In addition to the provider, the consumer needs to be an advocate for themselves and their families. We now know that if you're facing a surgery, there are certain surgeries where you can get some non-narcotic medications prior to that surgery, require less narcotics during your hospital stay, and far less when you go home. This has been proven very well with C-sections, because 1 to 2% of women in this country who are not drug users become addicts after being prescribed narcotics for a C-section. These are young mothers. So you may sometimes have to question your healthcare provider. Is there some alternative you can give me besides these pain pills? Is there a way you can help my surgery still go smoothly and help me be comfortable without resorting to narcotics? And you can get less. If your prescriber routinely prescribes, as I mentioned, 30, that's pretty standard. You can say, I don't need that many, or you don't have to have that many filled. So be an advocate for yourselves and your family. These narcotics sit in medicine cabinets where they are oftentimes ingested by a babysitter, a nephew, someone who should not be using these narcotics. I'm sure you in the ER see that.
Yeah, well, that's one thing I was going to say from some of the legislation that Senator Grooms talks about. It's been extremely effective. A few years ago, when there's a way you can search someone's history of filling narcotic prescriptions. And it used to be, I would see 60, 70 prescriptions by 30 or 40 different doctors. And that's not appropriate filling. There's no logical reason for that. That has become mandatory now. If you're going to prescribe a controlled substance, you have to look up someone's record. Just knowing that now, it's almost unheard of to find those kind of records anymore. I never see, that kind of doctor shopping or anything when we do those. It's very, very rare because those providers have been weeded out or have changed their behaviors as a result of that legislature. The other thing that's changed just recently is now controlled substances have to be electronically prescribed. And that's a big deal too, because that really decreases fraud, forgery, things like that as well, and lets both the provider and the pharmacies kind of be a gatekeeper in those scenarios too. So some of those things have been extremely effective in making sure that if controlled substances are going to be prescribed, they're prescribed in a responsible and appropriate manner. And from our ER side of things, it's even down 3 days is what our limit is for a controlled substance prescription. So. And then, we do linkage to care. So if somebody has a condition that needs, longer, that's fine. And we make some arrangements for it, but that's how that's handled right off the bat. So those have all been extremely effective.
All right. Thank you, sir. Any questions? We've got about 10 minutes. Sure.
two or three things. One of the things I'd like to know about is, one of the difficulties we have as a border community is that we oftentimes could get treatment in Louisville and do it very effectively, but because people aren't able to access Medicaid, Medicare, if they're in a different state from Indiana, then we have to travel to Fort Wayne or to wherever 4.5 hours away when we're 10 minutes away from effective treatment. And when I talk to other communities around the state, like Cincinnati and the Lawrenceburg, Kentucky area and East Chicago, they have the same dilemma. So could we get a commitment from you guys to examine that legislatively? Because it's a policy issue. It's not a law. And it isn't that way in a lot of states. But when we're a border community, it just disrupts somebody's life totally to have them shipped 4.5 hours away when they could be 10 minutes from their home and their families and their employers and the stability they need to return home to. So basically what I'm asking as an advocate is that we get a commitment from the four of you, and I want one from Chris too, that says you'll look at that and advocate for us on at least making that policy change. Good. The other, Rita, there was a question for you basically about, and you too, Dr. Yazel, do we have any records on how many babies are currently being born into addiction?
Well, because we have not, do we know how many babies have died from addiction or born into addiction? Because there was such difficulty in the documentation of the pregnancy, the delivery, what factors were involved in the delivery, until we had this maternal mortality review committee, we really didn't know how widespread this was. And then this is also going to fall over into the infant mortality data as well. So we're just now beginning to understand that. But there were, I believe, 68 maternal deaths in 2018, not to mention a very large number of very sick women who didn't die. And the overwhelming number one factor was substance abuse. Some of those infants did not survive either. So I think we are beginning to take a closer look at this. We're still gathering data. But again, let's help them not get pregnant in the first place when they don't want to be. We certainly will care for them when that pregnancy occurs. But I think so many women would opt for services if they could help prevent it.
One thing I'll say while we're waiting for our next question or anything is Clark, I don't have statistics I can give you, but I know Clark Memorial Health has a neonatal abstinence program that is excellent. And basically for those at home, that is a baby who is born to a mother who is using, who has substance use disorder and is using at the time of delivery. A lot of times the babies will suffer from some withdrawal symptoms. They have an excellent program in that area.
One more comment is opioid use has decreased significantly over the past couple of years, but other drugs are replacing it, like methamphetamine. And that doesn't have the same effect on neonates as opioids do. We more often see babies that are very poorly grown, babies that are malnourished, and then unfortunately moms who are in no condition with methamphetamine to take care of a baby both before and after it's born.
Thank you. Can you hear me? I worked on a bill 2 years ago with Dr. Berner at Clark Memorial that dealt with the neonatal issue in Clark Memorial. At that time, there were 5 babies born every week who were eligible for the neonatal care unit. So that is a tremendous asset that we have in Southern Indiana to have that neonatal care unit here. It's modeled a little bit after the hospital in Louisville, but it's an excellent program. I think it's funded for another year. So thank you.
We are just about out of time. So I want to thank everybody for being on the panel. Things like this are extremely important to get the word out, to show community support, that show some unity. As always, I'm impressed that these are leaders in Indianapolis, but they're not. These are people from our family and friends. These are people that work with us every day. So these are us representing us in Indianapolis. And so I am extremely thrilled and proud of each and every one of you guys. Thank you for coming onto the panel today. Does anybody have any closing remarks?
I'm so proud to live in this community and to be a part of Clark County Cares. I think that Clark County is the bright spot in the sunny side of Louisville. And it shows by people like Barb Anderson and Judge Jacobs and all of the people who are so deeply involved in this effort and truly care about the people in this community. So a big thanks to all of you.
Thank you. The Drug Enforcement Administration controls the supply in this sense. That helps a lot. It doesn't control the entire supply chain of opioids, but pharmacies are audited, obviously. Pharmacies that buy from a wholesaler, direct from that wholesaler, the wholesaler has limits on how many opioid drugs quantities they can just deliver in a month. And when a pharmacy reaches that level, they can no longer buy opioid prescriptions, drugs. So that has been a major improvement in the supply chain. If Hanger Pharmacy or Walgreens gets up to their 2,400 limit, they can't fill any more prescriptions. So they have an interest in this also. Also, your question about the DEA, a doctor licensed in Louisville has to have a DEA permit for a pharmacy in Indiana can fill that. They also must be licensed with a controlled substance in the state of Indiana. Because we're so close, a lot of physicians who prescribe those, particularly surgeons, et cetera, are licensed in both states, both federally and by the state of Indiana. So that enables the patient from Louisville to come to Jeffersonville and vice versa to get a Schedule II prescription filled.
Thank you. Thanks to everyone for watching today. I wish we could be together in person, but as with so many things right now, it's good that we're still able to carry on virtually. And thanks to Clark County Cares and to Barb Anderson and Judge Jacobs. Judge Jacobs asked, why each of us came, and I think we all reflexively answered because Barb asked us to. So, but Barb does so much in our community and has for so long. So thanks, Barb, for your ongoing advocacy. And I'll just close by reminding everybody about the important role, the critical role of advocacy. I mentioned early on that one of my concerns is that even though many people still recognize the urgency of continuing to address the opioid crisis and substance use disorder more broadly, it doesn't seem to have the prominence that it had a few years ago, and we just need to make sure that it stays at the top of the list on an ongoing basis. And that we don't lose sight of the need for for the work to continue. And I know I'm preaching to the choir in terms of everybody who is participating in this, but everybody needs to go out and talk to your coworkers and your friends and your neighbors and make sure they know that this is not something we can check off the list, that there's still much work to be done, and we need to continue that work in both a sustained and sustainable fashion. So again, thank you to everyone. And with that, I'll let Dr. Yazel have the final word.
Well, I just wanted to say same thing. Thanks to everybody from home for watching. Thanks to Ashley and Barb, Judge Jacobs, everybody from Clark County Cares for putting another great week together. It's a lot of hard work to do this. And I know with all the challenges with COVID and going virtual, that's added a whole nother wrinkle to that, to thank you. And thank you to you guys for being here today. I know your schedules are pretty crazy also, and I just once again I just can't say enough how blessed we are to have the elected leadership we do down here with the interest in public health and putting so many great initiatives out that make a huge difference. So just want to say thank you to you guys as well.
All right. Well, we are definitely out of time. So again, I want to thank each of you guys. I'm impressed by what you do every single time. So thank you for being here. We appreciate that. Tomorrow, the Big Four Bridge is our candlelight vigil, starting roughly 5:30. We try to get it going so that the candles are all lit when the sun goes down. That'll be the wrap up. This has been a fantastic week as usual. I think this was a perfect way to end the formal parts of it. Monday morning, 8:30 will be our regular planning committee meeting on Zoom. Follow Facebook for that information. And again, thank you to Melinda and Carolyn King. We couldn't do this without them. So hopefully I will see everybody tomorrow evening at the Big Four Bridge starting roughly 5:30 p.m. Thank you.